Good day, everyone. I am Dr. Jennifer Manzano, the Program Director of the Asian Brain Institute. Last October 29, we celebrated the World Stroke Day to raise awareness on the treatment and prevention of stroke and to ensure better care and support for stroke survivors. Today, I am here to answer your questions about stroke. For our first question, what is a stroke? A stroke happens when there is an interruption in the blood supply to the brain. There are two kinds of stroke. One is when an artery or a blood vessel that supplies blood to the brain becomes blocked. And so if the blood vessel is blocked, there is no blood flow to the brain cells. If there is no blood flow, there's no oxygen and there's no nutrients for the brain cells, and the brain cells get damaged and die. The other kind of stroke is a hemorrhagic stroke or a bleed. This means that there is bleeding in the brain and the blood interrupts the metabolism of the brain cells, and so the brain cells die. A stroke creates a focal neurologic deficit. This means that the stroke will cause symptoms according to where the stroke is. What are the signs of stroke? So the signs and symptoms of a stroke will depend on where or which part of the brain the stroke happens. For example, if the stroke happens in that part of the brain that moves your leg, then you will have leg weakness. If the stroke happens in that part of the brain that subserves language, then a person might have language difficulties, be it understanding what is being said or having the words in what one wants to say. Or the person may also have difficulty in speaking. So the signs and symptoms of stroke will depend on where the stroke is. However, the most common signs of symptoms are these: problems in balance, problems in eyesight, problems in face, arm, and speech. So that it's easier for everyone, just remember, be fast. B stands for balance. You ask a person or you observe the person if the person can stand properly, can walk properly. E stands for eyes. Look at how the person's eyes move. Or if the person complains of visual problems, be it doubling of vision or visual loss. F stands for facial droop. You ask a person to smile. If a person who is having a stroke has facial drooping, then the person might be having a stroke. A stands for arm. You ask a person to raise both arms, and the person with the stroke will have one arm going down because it is weak. And then S stands for speech. You listen very well to how the person is speaking. If the person is talking gibberishly, or if the person can understand what is being told him. So these are the signs and symptoms of stroke, and what is important is T. Be fast means you have to be fast because time is brain. This means that you have to go to the nearest stroke-ready hospital if you have any of the signs or symptoms of stroke. And also, Asian Hospital is stroke-ready. The third question is, what are the risk factors of stroke? A risk factor is something that increases your risk of getting a stroke. The most common risk factors are age, which you can't do anything about, hypertension or increased blood pressure, high blood cholesterol, high blood sugar, problems in the heart, and I'm not talking about your love life, and problems in the blood. So blood pressure is perhaps the most common and the most important risk factor for stroke. A high blood pressure means that your resting blood pressure is above 130/80 on two separate occasions. If this happens, you have to consult your doctor right away so that it can be managed. High blood sugar or diabetes increases the risk of getting a stroke by about 200%. So if you have family members who are diabetic, then you might need to screen for diabetes to lessen your risk of getting another stroke. High blood cholesterol, especially high bad cholesterol, also increases the risk of stroke. So you have to think twice before you eat that hamburger that you're holding right now. Any problems with the heart will increase your risk of stroke. If there is any abnormality in your heart rhythm, if there is any problem in the valves of your heart or in the way that your heart moves, that may also increase your risk of stroke. Lastly, some problems in the blood make your blood more easily coagulable, or that means your blood clots more easily compared to others, and that also puts you at risk of having a stroke. If you have any of these, you are welcome to consult us at the Asian Brain Institute or any neurologist at Asian Hospital. The next question is actually very important. What is the primary prevention of stroke? Primary prevention means that you do not have yet risk factors that make you at an increased risk of stroke. So that could be actually almost any one of us. Primary prevention entails things that have been taught to us since we were in kindergarten, but which we seem to have forgotten. Number one, we have to have a healthy diet. And healthy diet means you eat more greens, you take less fat, less salt, things that have been taught to us. Number two, we have to get physical activity of at least 30 minutes duration every day. This can be anything. You don't necessarily need to go to the gym. You can walk around, but make sure you put on your mask if you're going outside. You can also swim for 30 minutes. You can do house chores for 30 minutes. You can walk your dog for 30 minutes. 30 minutes, the duration of 30 minutes is very important because it is what it takes to properly exercise your heart and your muscles to ensure good blood flow to the brain. Number three, you have to get adequate sleep. Not getting adequate sleep actually increases your risk of getting high cholesterol, of getting high blood sugar, and also high blood pressure. So it's very important to get at least 7 hours of quality sleep every day. And if you aren't getting quality sleep, please feel free to visit ABI to ask us how. The last question is, what do you expect after a stroke? After a stroke, depending on whether you got the appropriate treatment or not, you might have to undergo rehabilitation. This is important because rehabilitation will help you go back to the kind of life and physical activity and even mental activity that you used to have prior to stroke. The recovery from a stroke can occur in at least 3 months to up to at least a year. There are some studies that will say that a person with a stroke can actually improve even beyond 1 year. What is important is that you have your family support with regards your diet, with regards your rehabilitation, and even how to set up your home. After a stroke, you may have problems with walking around, and in that case, you might need ambulatory aids like a cane or a walker. After a stroke, you must ensure proper control of your risk factors. After a stroke, you might have sexual problems or intimacy problems. And after a stroke, you might not be able to go back to your work right away. But I am sure that your doctor will help you go back to as close to the kind of life that you had before a stroke. And if you want to discuss more, please look at the Facebook page of the Asian Hospital and the Asian Brain Institute because we've had some of these things covered for you. Before we end, let me close with this very important reminder. If you think you are having a stroke, or if you think somebody you know is having a stroke, go to the nearest stroke-ready hospital. The Asian Hospital is one of the few stroke-ready hospitals in the Philippines. If you have any questions or inquiries about any of the things that we discussed today, Please feel free to call us at the Asian Brain Institute or visit our Facebook page.